Taoiseach, on the abandonment of the PCR testing for the majority of the population, people with symptoms who need a test, as has been said, will have to pay €90 privately to have it done. The vast majority of them will. And for a lot of medically vulnerable groups who've written and accounted for this in a letter to the department, they are worried about the abandonment of most measures like masking and testing and tracing. But my question to you is, what new systems will be put in place to track the virus, as fewer people are going to be tested for it? Because it has been reported in the papers that new systems will be put in place, but there's no explanation as to what those systems are. Or is the state proposing to abandon tracking the virus at all, in its entirety and at all costs?
Taoiseach.
I thank the Deputy for raising the issue. No, the Chief Medical Officer is very clear that we have to move to a different phase of the pandemic, and that the whole sale, testing and tracing regime will no longer apply during that transitional period, and that we have to embed into our existing public health system permanent responses, surveillance of the disease and other diseases. So the Sentinel system, for example, which is a GP-based system, will be expanded. We've already agreed last year to double the allocation, funding-wise, to public health in this country, leading to, for the first time, consultant appointments, but also a strengthening of the capacity within public health in terms of personnel, and the recruitment has gone well, I understand, in respect of that. So that whole public health system will be key to surveillance and monitoring of the disease as we go forward.